So today we're going to be doing wound care. As always, knock on the door, hand hygiene, put on your glove, and make sure you have the correct patient by using 2 identifiers. We're going to start off today by doing the wet to damp dressing. This is a sterile technique, so you're going to want to open your sterile kit, grab your sterile drape for your patient, grab your sterile field, touching only the border, dump your contents onto the sterile field without contaminating your contents. We are removing the soiled dressing, and right now we're going to check for Rita O, which is redness, yes, edema, yes, ecchymosis, no, drainage, yes, approximation, not approximated, and odor not present. Now that we've assessed the wound, we are now going to put on our sterile gloves. This requires removing our old gloves and performing hand hygiene prior. Always placing our dominant hand in the glove first and scooping underneath the cuff to put our non-dominant hand in the sterile glove. We're now grabbing a gauze square, spreading it apart and soaking it, and then wringing it in the normal saline. We're now packing that into our wound. Then grabbing another gauze square, placing it over the packing, and then grabbing our sterile dressing, placing it on top of our gauze, removing our sterile gloves, and adding strips of tape to secure the dressing, as well as documenting what we've seen and done. With our next procedure, we again are going to need sterile technique. This procedure is going to be irrigation. Applying our sterile gloves. We currently have our sterile drape and sterile basin set up underneath the wound. To catch the irrigation we're now drawing up saline and putting it across the wound, back and forth, and repeating this procedure. Then disposing of that and grabbing a gauze. Holding it by the four corners and dabbing around the wound, not in the wound, just to dry the area. We're then going to apply a sterile dressing. And secure it with tape, as well as documenting what we did and what we saw of the wound, our assessment. Always perform hand hygiene and document